As a psychiatrist, I have the honor and pleasure to serve a lot of professional women of color. They come to me because they identify with me. They are also hopeful that I identify with them in a way that allows them to feel comfortable being vulnerable with me in a visit. They're looking for an experience where they don't have to define their existence just to be seen and heard. Over the last couple of years, I've had an increase in women come to me and say, God, my workplace is really affecting my mental health. I think I have imposter syndrome. I need some help working through that. What I know is that it's going to be really hard to work on that one sided relationship when there's another party involved. So, what is imposter syndrome? It's a term that was coined in the late 1970s by these two women researchers, doctors Pauline Clance and Suzanne Imes. They worked with over 150 women, women who were at the top of their game, women who had achieved high educational status, PhD, master's level, students who had exemplary records, women who were just at the top of their field. These women were killing it, but despite all of the evidence to the contrary, they didn't think they belonged. They felt like phonies. They felt like fraud. They were killing it, y'all. I think about what it must have been like in the late 1970s to be in this position, to be a woman high in academia, high in the C-suite, just in any industry. It had to feel like being under a microscope most of the time. I also imagine that most of the spaces were not very estrogen heavy. I bet there were lots of men in these spaces who, in subtle ways and not so subtle ways, told these women they just didn't belong. And now we tell women, well, you're just not doing well. You're not satisfied in your job. I don't really know why you're qualified. We wouldn't have brought you here if we didn't think you could do the job. Maybe you should go see a psychiatrist. Maybe you need to work on your mindset. And yes. We absolutely need a mindset shift because we have internalized all of the negative attitudes and the biases that have been thrown at us for years and years. So I think about the people that come to see me. I think about my one patient who is a first generation physician. She's a new physician. She's excited. She's in training. She gets to her residency program and everybody shortens her last name to Dr. O because, it's easy. It's easy for her superiors. It's easier for her colleagues. It's easier for staff. It's easier for patients. I mean, we really just don't want to inconvenience people by them having to learn how to pronounce her last name. It's 4 syllables. We pronounce hard words all the time. In medicine, we for sure pronounce hard words with lots of syllables all the time. Nobody thought to ask her how she felt about the shortening. Nobody thought, or maybe they just didn't care to think about the fact that for many cultures, your surname is linked to your identity. And to just shorten that and take that away from you essentially says, we're glad you're here, but we don't really value your presence and your identity enough to even have that conversation with you before we shorten your name. I think about another patient of mine who's a professional school student. She was miserable, depressed, anxious. She was thinking about just quitting. As a matter of fact, someone in leadership at her school told her she probably should just quit, cut her losses, go home. She did leave that school, but she didn't give up. She went to a different school, and now she's thriving. What do you think's different about her? Not a single thing. Her environment is different. They know her name. They ask her about her well-being. They include her in things. She feels seen and heard in a way that she never did in her previous environment. I think about little medical student me so many years ago, trying to be a good wife, trying to be a good medical student, honestly feeling like I was failing at both of those things, being pregnant with my first kid on my clinical rotation and overhearing and attending male physicians say that he didn't think that women should have kids if they were going to be in medicine because it makes them not be as great a doctor if they had a family. Having another male attending physician not even bother to learn any of the names of the women who were on the rotation. He just called us all toots for the whole month. I think about my patient who is a VP, and she was brought into the office when she started to go natural with her hair and told that her hair was distracting and that it was against the organizational policies on hygiene and grooming. They told her that her physical existence was in violation of company policy. We are really out here trying to fit in spaces that were not meant for us to be successful. They weren't made for women to be successful. They most certainly were not made for women of color to be successful. But here we are. Remember when we were kids and you had those little games, the developmental game with the pegs and the holes? So us out here fighting, trying to get into the C-suite, trying to stay there once we get there, trying to become attorneys and physicians. We're the square peg. The environments that we're fighting to function in that weren't meant for us are the round holes. And you close your eyes and think about what happens when you try to force a square peg into a round hole. You start thinking, that used to be a square. It used to have sharp edges. It's dull now. Is it a square? Is memory serving me correctly? Was it ever a square? I sure thought it was a square. And depending on what it's made of, if you push hard enough, that square might break. And what does your break look like? Is it anxiety? Is it depression? Is it extreme burnout? Is it physical symptoms that you and your doctor can't explain? Or is it you showing up to a psychiatrist's office and saying, I have imposter syndrome and I'm broken and I need you to help fix me? And we can fix some things. We can unpack all your stuff. We can work on self-esteem. We can work on anxiety. We can work on depression. But your imposter syndrome might be a little bit difficult. It'd be like trying to do couples counseling when only one of you is present. So, in preparation for this talk, I surveyed some of my patients. I asked about 50 professional women of color about imposter symptoms. About 40 or 80% of those women said that at some point in their career, they have felt some symptoms of being an imposter. Of those 40, 100% could identify microaggressions, macroaggressions, and other environmental things that added to that feeling. Only 25% could say that their organization or the places they've worked had any kind of policies or protocols in place to help lessen that burden for them. 25% is kind of sad, but it lets me know it's possible. Our organizations have a lot of power to make this right, to make this better for those of us who are fighting to find our space in this world. So what can your organization do? I'll give you 3 small places to start. 1, ask the question. Don't avoid asking the question because you're afraid of the answer and afraid of having to do something about it. Ask your employees about any biases they've experienced. Ask them about microaggressions. Ask them about inclusion efforts. See what they have to say. Second, you have your data. Review what you have. Look at your organizational chart. All of your answers are there. Who's being promoted? Better question, who's not and why? What does your leadership photo look like? If you have pipeline programs to leadership, who's being involved in those? Who's being left out? And the last thing would be to consider moving from a mentorship model to more of a sponsorship model. You have the power, the organizations have the power to make that glass ceiling just a tad bit less dangerous for those of us who continue to be brave enough to climb. And you'll be better off for it, because we know that when employees feel engaged and they feel included, they do amazing things to move the mission of the organization forward. And they just might not show up to see a psychiatrist saying that they have imposter syndrome and they need to be fixed.